Thank you all for joining us today for our panel discussion, Improving Women's Health and Children's Health through Innovation and Collaboration. We are excited to have so many women from all over the world joining us today. My name is Elizabeth Cullen, and I am Hadassah's Director of Government Relations. We're going to learn a lot today about remarkable advances being made in women's maternal, mental, and cardiovascular health in Israel, and how these advances can be shared and replicated worldwide to advance global women's health. First, I want to remind all our attendees we're dedicated to ensuring that we have an open and respectful dialogue today, and we reserve the right to remove anyone disrupting today's discussion. But I am thrilled to begin our discussion today by introducing our moderator, Ellen Finkelstein, Hadassah's CEO. We are the largest Zionist and Jewish women's organization in the US. Through our Jerusalem-based hospital system, the Hadassah Medical Organization, Hadassah helps support exemplary care for more than 1 million people annually, as well as world-renowned medical research. We believe the work being done at Hadassah Medical Organization is crucial to advancing gender equality and women's well-being through healthcare and building bridges to peace. We are honored to have Ellen here with us today to moderate today's discussion. Thank you.
Thank you, Elizabeth, for that wonderful introduction. It's really a privilege for me to be here today to learn from our panelists and to share more about the life-changing work that they are involved in at Hadassah Medical Organization in Israel. First, I want to thank our partners, the Israel Women's Network and the Simon Wiesenthal Center. Your partnership over the years and on today's event has been invaluable. I'm honored at this point to introduce Dr. Deborah Safin, a pediatrician and women and children's advocate at the Simon Wiesenthal Center, who will share more about their work to advance peace in the Middle East and the safety of women and children in the region.
Thank you. Good afternoon, everyone. My name is Dr. Deborah Safin. I have the honor of representing the Simon Wiesenthal Center, a longstanding accredited NGO at the UN with ECOSOC status. We are proud to partner with Hadassah for this important conference. As a pediatrician myself and the women's and children's advocate for the Simon Wiesenthal Center, I commend the Hadassah Medical Organization for their decades of world-renowned excellence in medicine. Not enough credit is given to the Israeli Jewish and Arab healthcare professionals who put politics aside and work hand in hand to deliver quality care equally to all their patients. The Simon Wiesenthal Center has long promoted tolerance and peace, and Israel's medical community embodies that goal. Nothing is more precious to a woman than her children, and this war has taken a tremendous toll on the women and children in the region. As a senior representative of the Simon Wiesenthal Center at the UN, I had the privilege to recently meet with the heads of UNICEF to advocate on behalf of the Israeli women, children, and families, both Jewish and Arab, who have suffered physically and mentally during this war. As of last March, nearly 20,000 Israeli children, of which over 7,000 were less than 6 years of age, were found to be victims of hostilities, either physically, mentally, or both. These findings were submitted to the UN Committee on the Rights of the Child. To meet these needs has been a challenge. Presently, Israel finds itself with a shortage of approximately 5,000 child psychologists, as well as many psychiatrists and social workers, especially in Israel's periphery and the Arab sector. Many of Israel's pediatricians lack adequate training in trauma-related care. Thousands of Israeli families with children have been displaced from their homes for over a year, traumatized by frequent rocket attacks and the need to find immediate shelter. Although UN organizations such as UNICEF are aware of the overwhelming numbers of PTSD sufferers among Israeli women and children and are sharing best practices, as is the case today, the Simon Wiesenthal Center has been advocating that more be done. As NGO representatives at the UN, we have a responsibility to counter any anti-Israel bias that manifests itself in so many ways at numerous venues. Silence, apathy, and denial of the suffering is not to be tolerated. We continue to do just that to expand our efforts along with Hadassah to create alliances and cooperation for the protection of all women and all children around the world. Along with Hadassah, the Simon Wiesenthal Center is proud to emphasize Israeli society's contribution to the protection and dignity of all women and children. The Hadassah Medical Organization is at the forefront of this effort to address these needs. We applaud Hadassah's dedicated medical professionals and are proud to co-sponsor this conference. Thank you.
Thank you, Dr. Safin, for sharing the outstanding work that you and the Simon Wiesenthal Center are pushing forward in the Middle East. We deeply appreciate your partnership on today's event. On a recent trip to Israel, I had the opportunity to see firsthand the superlative work that is being done at Hadassah Medical Organization's 2 hospitals in Jerusalem, the only American-owned hospitals in Israel. I was so impressed by the diverse staff working to provide exemplary care to a diverse group of patients. At Hadassah Medical Organization, Arab and Jewish Israelis work side by side to treat all patients, regardless of religion, race, or nationality. Dr. Shadin Samaleh, director of the Hadassah Hospital Mount Scopus Emergency Medical Department, is the first Arab female physician to head up a hospital emergency room in Israel. Professor Rifat Safadi, an Arab Israeli, is head of the Liver Disease Center of the Gastroenterology and Liver Diseases Institute at Hadassah University Hospital. Professor Safadi regularly returns to the largely Arab community in which he was raised to provide medical aid. As a global humanitarian organization, Hadassah is committed to building bridges to peace. Hadassah Medical Organization offers a program tailored to young Arab men and women ages 17 to 23 who want to volunteer. The program has been so successful that even volunteers who live far from the hospital, including those who reside on the other side of the border checkpoint, come daily. In 2025, Newsweek named Hadassah Medical Organization one of the best hospitals in the world, earning a top spot in cardiology for the 5th year in a row and a top spot in both oncology and the use of smart technology for a 4th year in a row. In 2005, Hadassah's world-renowned hospitals earned a Nobel Peace Prize nomination for building bridges through peace through medicine. Today, we are here as part of the year's Commission on the Status of Women to celebrate the 30th anniversary of the 4th World Conference on Women and the adoption of the Beijing Declaration and Platform for Action. The Beijing Declaration, considered the most progressive blueprint for advancing women's rights is a global plan to achieve gender equality and women's rights in 12 identified critical areas of concern, including healthcare, economic empowerment, education and training, and violence against women. Through various meetings, events, and workshops, the goal for this CSW conference is to evaluate the implementation of the Beijing Declaration and identify areas for improvement ahead of the 2030 Agenda for Sustainable Development. Today's panel, Improving Women and Children's Health Through Innovation and Collaboration, will highlight a few important areas for improving women's health from the Beijing Declaration: maternal, mental, and cardiovascular health. Our panelists, all doctors from Hadassah Medical Organization, will discuss how the advances and contributions being made at Hadassah Medical Organization hospitals are resulting in better health for women in Israel and the Middle East, and how they can be shared and replicated worldwide to advance women's health globally. Our panelists, through this remarkable research and care that continues even during a time of war, doctors and other healthcare professionals at Hadassah Medical Organization are working to tackle these dangerous gaps in women's health head-on and to build meaningful bridges to peace through exceptional healthcare for all. I'm excited to jump into the questions and hear from our incredible panelists. First, We are so glad today to have Dr. Esti Galil-Weistab with us. Dr. Galili-Weistab founded the Binational School of Psychotherapy, which works through Hadassah Medical Organization to train Israeli and Palestinian mental health professionals in psychotherapy based on the best practices in adolescent mental health treatment. Dr. Galili-Weistab, you have been a leader in responding to trauma in adolescents for some time, having worked in crisis zones in Lebanon, Ukraine, Mexico, and more. Your work at the Binational School of Psychotherapy contributes to cross-border learning and cooperation between Israeli and Palestinian mental health professionals. Please tell us more about why you founded the Binational School of Psychotherapy and why you think responding to adolescent mental health treatment is such a critical piece of the response to the Israeli-Palestinian conflict.
Thank you very much for the warm introduction. I would like to thank you all for joining us, and I feel honored to share my experience, my thoughts, and my feelings with you during these very turbulent and challenging times. I deeply appreciate, unfortunately, our limitations to change things that we believe are important. Yet, I believe in our deep responsibility to remain devoted and invest in moving things forward in a hopeful and positive direction, step by step, but never giving up. And I would like to quote an old Jewish saying, over 1,500 years old. Everything is predetermined, but there is freedom of choice. In this platform that allows discussion about women's health, it's natural to center around one of the main areas that affect our life as women. It's family and children. Children and adolescents' mental health is a challenge mainly for the mothers, but also for educators and health providers that are also mainly women. So, back to 2002, 2003, during an international conference of child and adolescent psychiatry in Berlin, professionals from Gaza, West Bank, and Israel shared the post-traumatic clinical reality among children and adolescents that live in the area. Discovering that the Israelis and Palestinians are actually mirror images, it pained us, but it also encouraged us to try and find ways to help our young generation while getting to know our neighbor and creating a mutual opportunity to encourage change. The idea was a real opportunity for meaningful relationship. So, talking to our Palestinian colleagues, we realized that there is no psychotherapeutic training in the West Bank and Gaza, and we created a school, a binational school for psychotherapy. The center is a 2-year training, once a week, 7-hour meetings that start with eating lunch together and then learning together till the evening. Teachers were the best professionals that live in the area, Israelis and Palestinian. They experience the same reality as the student, and they can provide ongoing presence, which is very different from visiting professors from abroad. On top of the academic teaching, there is personal supervision by experienced and senior therapists on a voluntary basis. Following everything is a group supervision, groups of 10, mixed students, Palestinians and Israeli, with a changing supervisor. We change him once a year, once an Israeli and then a Palestinian. No, you jumped with the slides. I'm sorry, I will need the first slide, but not yet. Okay, it's okay to leave it on. I'll go into it in a few minutes. One of the unique academic blocks that we teach is devoted to culturally sensitive psychotherapy. I think too much of the psychotherapy that we learn are Western European and North American oriented, and a lot of children live in other areas of the world. So we believe that culturally sensitive psychotherapy is important. We follow with a group process that encouraging to learn about the reality of the other, but also we have peace building workshops. Just to give you an example, in the second cohort, I will talk about the cohorts in a minute, during one of the flare-ups in the bombing of Gaza, of course, nothing is comparable to what we're experiencing in the last almost 18 months. A student living in Gaza shared via Zoom the reality outside her window, the bombing of Israeli planes. An Israeli psychologist, a woman rabbi, shared her experience with her adolescent children, who would then get up every morning for the duration of the flare-up, demanding to know how the colleague in Gaza is doing. It was the first time that they knew that there is a different reality across the border. So the first cohort launched 2016 with the support of the World Vision Organization from Australia, for 2 years. Then the second and two cohorts took place with 25 students each with the support of the EU between 2020 and 2023. And we actually were celebrating the opportunity to broaden the program via US aid. And we started that in September 2024, only to be shocked by the harsh reality and by the termination of the program at the end of January 2025. So I just want to give you a program overview of the fourth and fifth cohort that were supported by USAID. As I said, a psychotherapy training, 2 years, 45 mental health professionals, all that have MA in social work, psychology, could be art therapy. There are also some MDs in it. There's also therapeutic intervention for a 2-year course for 15 paraprofessionals, meaning speech therapists, physiotherapists, nurses, etc. Both the 45 and the 15, the 60 total students have lectures, group supervision, and individual supervision. We also have an EMDR course for 25 graduates of previous cohorts. We have Centray therapy, which is intervention for kind of play therapy for children and adolescents, also 25 graduates. And CPP, child parent psychotherapy, a modification that was created during the last crisis. Again, 25 graduates. And it's very, very important, you'll see the demographics of the student in a minute, to realize that there are 2/3 of Palestinians and 1/3 of Israeli Jewish students. We also have, we didn't start yet, webinars on the topics of suicide, self-harm, eating disorder, and another webinar to be decided. Following everything is with the peace building workshops. Just to show you the demographics of our students in the present. So the 14 Israeli Jewish female students and 3 male, total of 17. There are 3 Israeli Muslims, female. There are 17 total of Palestinians that live in East Jerusalem. There are 22 Palestinians from the West Bank, again, mainly female. And there are 2 students from Gaza. It's important for you to realize that we have an interest of many more students of Gaza, as of today of 10, but the reality there and the inability to join on the Zoom platform kept the number at 2, when one of the students from the West Bank actually every day when we finish teaching connects by phone to colleagues in Gaza to share the lectures that he received. So as of today, we have about 61 students. And to end my part at this point, I could have the next slide. I would like to quote from a psychologist from Bethlehem, a graduate of ours, in her words on the graduation ceremony. It was about 5 years ago. My friends, as we separate today, hoping this passion for learning would carry over in our lives, I trust you, for the sake of our children's well-being, to stay professional, help them dream big, keep the sky their limit, right the wrong, bear the sorrow, continue trying when they are weary, fight for justice, witness bravely, lend help, give voice to the voiceless, courage to the defenseless, strength and encouragement to the weak, and hope to the hopeless and helpless. If together we made it through by being tolerant, mindful, loving, empathetic, and understanding, they can follow our footsteps. So let's spread this edict in our communities. So,
Thank you so much, Dr. Galili Weistub, for that meaningful presentation. Really very remarkable and inspiring, the work that you're doing. We are honored today to have Dr. Hadar Rosen, who is the Director of Maternal Fetal Medicine Unit at Hadassah in Kerem, with us today. Israel has one of the lowest rates of maternal mortality of all countries around the world. Hadassah was founded over 100 years ago to improve maternal health in Israel. Dr. Rosen, as head of maternal fetal medicine at Hadassah, how are you working to advance women's maternal health in Israel, including for vulnerable populations? What do you think sets Israel apart as a world leader in maternal health care?
Thank you, Helen. Thank you for that kind introduction. It's a tremendous honor to join this distinguished panel for the 30th anniversary of the Beijing Declaration. I myself am the Director of Maternal Fetal Medicine at Hadassah in Kerem. I also I'm part of the Israeli Society for Maternal Fetal Medicine. I'm on the board, and through these this is where I work and where my work is done. I would like to tell you a little bit about Israel's healthcare system and how it has built really a successful maternal healthcare framework. So Israel actually stands among nations with one of the lowest mortality rates globally, an achievement that we're deeply proud of. And in the following slides, I'll try to share some data from recent years. As you can see here, Israel maintains an extraordinarily low maternal mortality rate at just 2 to 3 deaths per 100,000 live births per year. And to put this in perspective, looking at the world map, if we can go to the next slide, you can see how Israel stands out even more among developed nations. While WHO considers under 100 deaths per 100,000 births to be relatively low, Israel is at a low rate of 2 to 3, which is exceptional by any standard. And if we go on to see, we looked at the high income OECD countries, where we see that even there, Israel is lower than advanced states like the United States, Canada, France, and New Zealand. And this is the more recent data from 2022. This is worldwide data. You can see, sorry, this is the previous slide. Israel is at the far right on the graph with a very low maternity rate. So it's probably more interesting to hear how we get to that low maternity mortality rate. And this next slide, I'll try to show a few maybe of the approaches that help us do that. So I think our maternal field medicine approach is built on 5 foundational elements, and those are prevention, risk stratification, advanced level medical care, geographic availability of both primary and tertiary care, and widespread insurance coverage, plus care actually for anyone, regardless of coverage status. So looking at prevention, I put some pictures of our drop of milk clinics. Prevention is actually the cornerstone stone of our approach. We have a nationwide drop of milk. In Hebrew, it's called tipat chalav. These clinics serve as comprehensive maternal and infant health care centers. They are accessible in almost every neighborhood. They provide services regardless of socioeconomic status. These centers offer more than just basic care. They provide maternal mental health screening, developmental assessments for the babies, vaccinations, and nutritional guidance. And by identifying risks early as we do the screening, we prevent complications before they arise, or at least we identify them and we can address. This is a proactive stance that has proven especially effective in reaching vulnerable population, just like you asked me, Alan, including new immigrants, ultra-Orthodox communities, Bedouin women that live in remote villages. There are even mobile clinics that travel between remote villages to get to every mother, all the mothers and the babies out there. Another probably critical factor in our success is that there's universal healthcare coverage for all citizens in Israel. This means every pregnant woman has access to prenatal care, to specialized consultations, and to delivery services without concerns about costs at all. At Hadassah, we take this commitment further. We provide care to everyone who comes through our doors, regardless of their insurance status or ability to pay. Any payment question is only addressed after the medical care and the medical needs are met. And this approach ensures that financial considerations never compromise maternal health. And I think Hadassah is not unique by that. That's all the hospitals around across Israel. I myself run a clinic for women without status around Jerusalem. I run the maternal fetal clinic. We have a large clinic that has a fund that supports it, and we give care to the clinic gives care to many people, but my clinic, we give prenatal care, or we provide prenatal care for women that don't have coverage, as they're not citizens or don't have a status in Israel, but we actually provide them with all the blood work, the vaccination, the ultrasounds, and the delivery care. With our volunteers, we have some of our best physicians and world-renowned physicians volunteer in our clinic, do the ultrasounds, the follow-ups, and we have students and we have the midwives, we have volunteers, and we have the fund. We're lucky to have the fund that helps support that. There's also a geographic advantage of Israel being a small country, and therefore tertiary care is actually available within probably an hour and a half of drive anywhere. So that probably also helps us. I think our medical system prioritizes continuous also innovation. At Hadassah, we've pioneered some multidisciplinary approaches to high-risk pregnancies. We bring together specialists from various fields to address complex maternal fetal medicine challenges. I think also maybe one of the things I would like to address here, just as we heard before, is that our teams work collaboratively across cultural and religious divides. It's our teams and our patients, likewise. We work Jewish and Arab and Christian, some Arabs, Muslim, and some Christians. We work as healthcare professionals side by side. My residents, my colleagues, midwives that work with us, we're a really diverse team, and we work side by side. And it's not always the easiest. Sometimes tension is high, and especially throughout these last 18 months, we've had times of very intense tension around us. But I think we all feel, and this has been our reality. We walk through the doors of the hospital and we put some of the things we've been going through and maybe some of our personal considerations, we put them behind and we work together. And our team is amazing. And we find that even through we work through all the hardships and we've been able to maintain a very high level of medicine, of maternal fetal medicine, even throughout these difficult months. Our NICU went down to -4, so as not to be exposed to bombings. I myself did a C-section when I delivered a baby with the siren. Our C-section rooms, our operating theaters are safe rooms. So that was at the beginning of the. So I mean, we experienced all kinds of hardships, but still, thankfully, and probably due to our amazing team, we've been able to push through these difficult times and work together. And I think that is the basis of how we are able to provide care to everyone, even in these difficult times. So I think, I mean, probably to conclude this part, as we commemorate the Beijing Declaration, this 30th anniversary, I believe Israel's maternal health care model offers valuable insights for global implementation. The low maternal mortality rate is something that maybe we can help other countries reach. We have with our it actually has already been done in the Far East. The drops of milk mobile clinics has been implanted there and successfully as well. And at Hadassah, we remain committed to sharing our knowledge and innovation with the global community through collaboration, just like discussions like this one that we're having today. We can work together to ensure every woman everywhere has access to good maternal care that they deserve. Thank you.
Thank you, Dr. Rosen, on behalf of Hadassah Medical Organization, and all the women of Israel. We really appreciate the work that you do. I now have the honor of introducing Dr. Donna Zwas, Director of the Linda Joy Pollan Cardiovascular Wellness Center for Women at Hadassah Hospital in Jerusalem. Cardiovascular disease is the leading cause of death in women globally. Yet women are often misdiagnosed and even dismissed by doctors when showing signs of heart disease. Israel and Hadassah Medical Organization have emerged as leaders in treating cardiovascular health. Dr. Zwas, you have prioritized understanding of the unique biological and gendered aspect presented by women's heart health. Can you share more about your research and why you think taking a comprehensive approach to heart health is so crucial to women?
Thank you very much for the opportunity of being here today and reaching out to colleagues and hopefully potential partners throughout the world. I'm here today as a representative of a team of women who are working hard to promote women's heart health and to promote health equity and well-being, with the specific goals of preventing heart disease and reducing cardiovascular mortality in all women. And sometimes it feels like a big goal, and you can go to the next slide, but we believe in the what we call the socio-ecological model as a basis for developing a comprehensive approach to promoting women's heart health, from the individual to the interpersonal, organizational community, and ultimately to public policy. In terms of the individual, there is a lot that needs to be done to personalize medicine for women, from the fact that a lot of, or most of, cardiovascular research was done in men, with the idea being that women are just a smaller version of men. The medications that we use, the pills, are designed to be appropriate for male metabolism and not for female metabolism. The procedures are not optimized for women. And there's tremendous amounts of bias in how we respond to women who are seeking care. One of the interesting things that we found in our clinic is that we asked women, why did you come to a women's heart clinic? And the answer wasn't because I wanted, a women's approach. They just wanted us to listen. And that's one of the challenges that women face as they seek care all over the world. In terms of our interpersonal approach, we use digital and traditional media. We have Facebook and Instagram and even TikTok sites in Hebrew and Arabic, and we use that to increase the awareness of heart disease in women and to give women specific tools. On the organizational level, we partner with workplaces and we work hard to educate healthcare professionals. If I empower a woman to seek help if she's having chest pain or chest discomfort, but she goes to a doctor and the doctor doesn't do the evaluation that needs to be done, then we haven't achieved that much. So we're working with partners, we're working with healthcare professionals from all sorts. We also have a very specific interest in community-based participatory research, going out into the community, and I'll talk about that a little bit more. And we're also very interested in health policy in all sorts of different ways. You know, one of our proudest accomplishments, and this seems so small, is actually creating policy in Israel that women were asked to do stress tests with no covering on top. And just to create a policy mandate that requires that women can wear a covering when doing a stress test took a tremendous amount of work, but it's the kind of thing that just makes a difference every single day for women who are receiving cardiovascular care. So I wanted to talk a little bit about what we're doing in the community, because I think that's a unique aspect of our approach at Hadassah, the importance of community-based interventions. And by going into the community, we can work together with members of the community to make upstream differences, to make differences that are going to actually lead to prevention rather than just addressing our clinical services at small numbers of high-risk women. And by working with lower risk women, prevention can potentially be even more effective. So our approach to the community, you could go to the next slide, was actually going out to the community and asking people, what is it that they need in order to help themselves take care of themselves? And we were very surprised at the answers that we got. We had, I don't even remember now what we thought we were going to hear, but the bottom line was women told us, we want to take care of ourselves. We want to be responsible for our own care, but we don't have the resources to find out what it is that we actually need. We don't have the resources to advocate for ourselves, and we are not getting what we need from the healthcare professionals. So we developed, in the community, we developed workshops where we actually empowered women to actually figure out, to actually prepare for the doctor visit, advocate for themselves with the doctor, and actually take ownership of their own laboratory values and their own medical testing. In the Arab community, on the next slide, when we talked to them, we went in some similar directions and then some different directions. We went into schools in order to advocate, in order to help with there's a huge problem of obesity, sedentary lifestyle in our Arab sisters in Jerusalem. So health promoting schools programs, health literacy programs. There's the lifetime risk of diabetes in the Arab community is 50% compared to 25% in our Jewish women. We've developed an extensive diabetes prevention program, which I'll talk about a little later, high school leadership and community leadership, and really one of the big challenges, smoke-free homes. Smoking is extremely common in the Arab community, and helping women advocate for smoke-free homes is another one of our major goals. So I just wanted to just show a little bit of what our Arab Women's Leadership Program has led to. We take many women who have graduated our diabetes prevention program and give them special leadership with mentoring. It's a 3-month training program followed by a 1.5 years of mentoring as they plan and develop projects. Some of them develop education programs in their communities. Some of them go into their schools, and some of them have developed walking groups, which now have, weekly participation. It's the Arab world. It took them 2 years to get quote unquote permission from their husbands to leave their neighborhood when they went on their walking group. But it's become massive movement in these communities, and something that we're very proud of. They came to us and said, there's a real problem with child safety, and we were able to partner with the organization, have these women trained to do public safety interventions in their community in partnership with other organizations. And these women leaders have really been instrumental in helping their communities during Corona and in wartime. So just to summarize, it's really been a privilege to me. This is some of the members of our team to really learn from all sorts of communities around us to develop partnerships. And I hope that dialogues such as today can also bring to further partnerships.
Thank you so much, Dr. Zwas. We're going to be moving into several questions for all three panelists. We're going to end our discussion today with about 30 more minutes of questions and answers from the audience. So I'm going to remind everyone online that we have a Q&A box at the bottom of your screen. If you have questions that you'd like to submit, we'll get to them towards the end of our panel. I am so impressed by the exceptional work that you are all doing to advance maternal, mental, and cardiovascular health for women in Israel. Can you share more about how these treatments are being shared throughout the Middle East and globally? I'll start with Dr. Galili Weistab. How can psychologists in trauma zones across the globe adapt the teachings of the Binational School of Psychotherapy?
First of all, they have adopted it. And we know that our graduates have gone on to develop professionally, but also to affect their own communities. I just want to give one recent example. And a psychologist from the West Bank, who actually was incarcerated in Israel several years for being a PLO member way back. And now, as I said, a psychologist in a school. And he's working with young adolescents. And, when a child or an adolescent is suffering from anxiety and depression, they sometimes find destructive ways to deal with their pain. Destructive for them, destructive for their family, but also destructive to the society around them. A lot of the time they project the negativity on an imaginative, but also on a real enemy and aggravating the situation. So Anne describes how the young children, the young boys in the school that he works in, basically, instead of turning into being part of an armed movement against the enemy, find ways to invest in themselves, to invest in their studies, to invest in their future. And in a way, he was criticized by the headmaster of the school, because he said, before you took the course, you would see the boys once and that was the end of it, mainly because the boys weren't interested in therapy. Now they keep coming to you. So what basically I want to say is that we certainly believe that investing in mental health everywhere in the world is crucial for the future. Unfortunately, not enough support is channeled to that, but certainly in a post-traumatic society in the Middle East, it's crucial. And I believe that by adopting culturally sensitive therapies, by group processes, by peace-building workshops, you can actually affect the future of our area and actually the future of children everywhere in the world.
Thank you, Doctor. Dr. Rosen, I'm going to turn to you. How can countries like the United States, which amazingly enough has the highest maternal mortality rate of any developed country, learn from Israel?
We're a small country. And the US really, I mean, it's probably about disparities because there's a large difference between the high socioeconomic status where people get amazing care and we learn from the US, but it's probably looking at the lower socioeconomic communities that's where maybe we have, humbly, I have to say, we have a drop of milk to give the US as well. It's that outreach. I mean, if we're trying to learn from what we're doing is that it's that outreach to the women that are not as lucky, that probably even because they're at a lower socioeconomic status, they probably have higher risk for prenatal, like diabetes, like preeclampsia, like preterm labor. They're all like even postpartum hemorrhage, everything that we deal with daily. So I think outreach into those communities and probably also the basic coverage, some kind of coverage for all. I mean, very basic things can improve maternal health tremendously. If you identify, just by measuring blood pressure, if you identify preeclampsia on time, you can prevent mortality later on. If you identify someone that has a higher risk of blood clots, if you identify that on time and you do that screening, those are the reasons for maternal mortality and the higher reasons, things like what Dr. Swartz was telling us about the cardiovascular screening and the lowering the diabetes rates, all of those. I think this is again humbly as a small country, maybe this is where we give some insights.
Great. Thank you so much. Dr. Zwas, I'm going to turn to you. How can researchers around the world work to understand the nuances of women's heart health and promote better awareness of these differences?
So I have to say that in the field of cardiology, that I am blessed with colleagues around the world, in Israel and throughout the world, who are committed to promoting women's heart health. The Go Red movement that started in Israel has become an international movement. And women from all over the world get together and work to figure out how to share their experience and share their data so that we can do the analyses that will help. Some of the things that are helping us now are big data. One of the real advantages we have in Israel is our electronic medical record system with just every single bit of data about the healthcare of women and men over the past 20 years that we're working to use to understand more about the specific issues that face women. And also, artificial intelligence, machine learning, all sorts of other new tools that we can use by looking at big data and sharing big data in order to really figure out what it is that's going to help keep women healthy and safe. The other message that I would have is really the partnerships with the community. By going into the communities themselves problem solve and come up with the solutions that help us understand better what their needs are. And then we can use our problem solving skills to try to actually meet those needs.
Great. Thank you so much. Doctors, I have a number of questions for all of you or each of you, and I'm going to ask you to share as you will. Hadassah Medical Organization is committed to building cross-cultural connections and bridges to peace, even during times of war. Can you share more about how your work prioritizes peace and builds connections across Israel and the Middle East? And why do you think medicine is such a strong tool to connect people and advance peace? Dr. Galili Weistab, do you want to start? I think you need to unmute. Thank you. Yeah, I think you hit it twice.
Here we go. I wanted to say that I think that there's the two lessons that I believe in. It's long-term working relationships and over a one-time conference or weekend, which are sometimes very meaningful and emotional, but they're not really sustainable. And when you do long-term relationships, whether through work or residency or studying together, you really slowly and authentically build a relationship that is stable and can take the heavy load of conflict. And that's the only way to get and really realize somebody else's reality. That's, I think, one thing. The other thing, I think that it's important to learn from experiences from around the world, but it's very important to rely on colleagues that live in the area and have the same experience and can share it and support each other. And I think, lastly, that to keep communicating. I think whatever the burden is, to keep the communication open and to remember, and at least in my experience, that we share a common goal of believing in investing. In my area, it's mental health, but basically in all medicine, it's in health. And I believe that caretakers and health providers have a deep commitment to help people from all religions, from all obviously genders, and across the borders. So I do find it very, very encouraging, even through very painful times.
Thank you. Dr. Rosen or Dr. Zlas, do you have any thoughts on using medicine to connect people and advance peace?
So I see the specific contribution that we have at the Women's Heart Center in empowering leaders in the Jewish community and in the Arab community to envision ambitious goals, to give them the tools to do it, to do the needs assessment, to create objectives, to develop the tools and to address them. And by creating large goals and training people to partner to meet those goals, we can create the environment that enables partnership and dialogue. I think at this stage, sharing goals and working together to meet the goals, not necessarily addressing peace directly, but addressing the goals of health, wellness, and well-being. These are ways that we build the bridges that will ultimately lead to a better Middle East.
Thank you.
I'll share something personal with you. The reason I went on to be a doctor was that, I grew up in Israel all my life. My first war I experienced at I was fifth grade. It was the first Gulf War. And since then, every couple of years, we have something going on. So I always felt like the hospital and medicine was kind of a microcosmos where we put all that behind us. And when you go into the hospital, you kind of, you shed that piece of you and you just go, the person that you are just goes inside and takes care of whoever. And I think goes with what Dr. Galili Weissab said. Just working today in labor and delivery this morning, I mean, we had our team was diverse. And we had ultra-Orthodox patients, we had Arab patients, we had a Palestinian patient that came delivering with severe preeclampsia that was transferred to us. We had actually a lesbian couple. We had a surrogate. But every room you went in was like a different world. And you just come out the door and then you go in the next door and you're in the next world. And you have to adjust yourself and you even you find within yourself little pieces of every room. So I feel for me it's kind of healing to work in that environment, and I think if we can do it in a hospital, then there's no reason why we cannot do it outside the hospital. It's the same people. We are the same people that leave the hospital and go back home to wherever we live, be it where it is. So I hope that maybe we can set some kind of an example and take that back to outside the hospital.
Amen. Thank you for that. As I mentioned earlier, this year's CSW meetings celebrate the 30th anniversary of the Fourth World Conference on Women and adoption of the Beijing Declaration and Platform for Action. The Beijing Declaration, considered the most progressive blueprint for advancing women's rights, is a global plan to achieve gender equality and women's rights. Since the plan's adoption in 1995, how has the world moved closer to achieving equality for women? What changes still need to be made, and how can we prioritize those? Dr. Zwas, do you want to address that?
So this has been, I appreciate the opportunity to think about this right now, because I think that wartime and when a society is under significant stress, unfortunately, the first thing that's sacrificed is equality, equity, and women's rights. And a lot of what we have seen over the past months during this war is women putting their own needs aside in order to become caregivers, in order to support the larger effort. And it almost feels as if, in many ways, we're actually losing ground. So this is a wonderful opportunity for us to really take ourselves in hand, to think through how we can care for the caregivers, how we can empower the caregivers, and how we can resume our focus on promoting women's equality and moving women forward in this society.
Great, thank you. Dr. Rosen, any thoughts?
I think I agree with Dana. I think we have a long way to go. I don't think we're there yet. And definitely war times is a setback. I think for all, I mean, what I see is for all populations.
Thank you.
And especially, and for women and children and the babies.
We understand. You're all involved in such important research through Hadassah Medical Organization to advance women's rights through improved healthcare. Can you share what new specific scientific advances you're most excited about in your area of expertise, and how you think they will improve care for women and children around the world? Dr. Rosen, do you want to start with that?
Sure. I mean, the most exciting thing I feel I'm doing right now has to do with breast milk. We are looking actually into, without going into too much detail about the biology of it, but we're looking into microRNAs and exosomes that are passed from the mother to the baby through the breast milk. And I mean, we're looking into this in so many from so many approaches, but maybe to tell you one thing about stress, we're trying to see how stress, maternal stress affects the baby. Does it have to do with the IBD later, disease of the bowel? Does it have to do with learning disabilities? Does it have to do with ADHD later on? We're trying to, and I mean, not gladly, but we have women in stress situations that are having babies, and we try to identify those that are at the more extreme ends of stress, and we research their milk. I mean, I'm very privileged to work with the pediatric gastroenterology lab at Hadassah, and this is really we're at the frontier of medicine at that point, because there are quite a few revelations that hopefully we'll share in research soon, but very interesting. So maybe that's one thing.
That's exciting. Thank you, Dr. Dr. Galili Weistab, do you want to talk about any advances in mental health care?
I just want to say, Dr. Rosen, that obviously the mother-baby relationship, or the postpartum, or the stress of the mother at the beginning of the life is one of the main predictors to children's mental health. So it's so important and crucial. And yet, as I mentioned, I find it very difficult that we cannot affect lessening stress, but we just deal with the aftermath of it. But coming back to what I'm excited about is that we do a lot of research that's done all over the world about genetic markers for eating disorders, for suicidology, for PTSD. But right now we're starting a new research of the effects of psilocybin on highly depressed young people. And I do hope that with the new CNS affecting drugs that used to be psychedelic, we termed them psychedelic in the past, will have a new future for mental health, something that will break the standstill that we have over 50 years with pharmacological treatment. So we're very excited about that.
That is exciting. Thank you, Doctor. Dr. Zwas, do you want to finish with any advances in cardiovascular health?
So we've been working in many different areas, including therapeutics for cardiovascular diseases that are more specific to women. But for this audience, I wanted to focus on some things that we've learned in the community. We started out our diabetes prevention programs by culturally adapting the American Diabetes Prevention Program that was developed by the Center for Disease Control. And we culturally adapted it and changed it. And we soon found that it just didn't work. We were a bit devastated. And then we went back and we listened to the women that we worked with. And we realized that what allows these programs to work is by incorporating what we call resilience training. We found that the women in these programs knew everything, but the idea that you can take knowledge and then transform that into action was a piece that was missing. And by really focusing on self-efficacy, self-awareness, putting yourself in the center, and other emotion regulation and other tools, we were then able to transmit the information related to diabetes prevention in an extremely effective way. So we're now doing a randomized controlled trial where we're comparing the standard diabetes prevention program to our diabetes prevention plus resilience training. We get a lot of complaints from our team when they're randomized to the non-resilience because they're like, it's just not working. But I'm hoping that this is something that really people throughout the world will be able to incorporate into their medical education platforms so that we can really get effective results.
Great. Thank you so much. We're going to be moving on to some of the questions from our audience. I'll start with the first question, which reads, you ladies are all doing amazing work to help women in Israel. What is one of the many challenges you've had to overcome while finding ways to help the women of Israel? Dr. Rosen, do you want to attempt that?
Well, just going through medical school and residency. I myself have five children, so going through that with carrying children, delivering, having my own children, raising them in this this situation with I think for me that was a hardship for me. Just going through it. It's a long and difficult course in Israel. To go through medical school residency, and as women, we have to do that along with other chores, maybe. So for me, that was the hard part.
So following up on that, the next question is, you all have the title of doctor, which means you worked for that title. What are some of the challenging preconceived notions or biases that you've had to overcome at your important roles in the hospital? Have there been any? Dr. Galili Weistab.
I actually, first of all, we have to realize that at least, and I studied 40 years ago, there were 50 female students already in my cohort. So medicine, at least in Israel, they're mostly women doctors. I think the issue is being in leading academic positions. And I must admit, again, mental health, which is probably different. Obstetrics went through a lot of changes. Cardiology still think that probably women are a minority. But in mental health, we were always a majority. And actually, it was the other way around. We had to encourage more, I would say, males to go into the field, psychology and social work and medicine, because the diversity is crucial. I felt very supported always in Hadassah. Maybe because we felt there that we have the backing of the Hadassah Women International Organization. But I never felt that there was anything stopping me. Of course, having children, of course, wanting to share energy between home and professional life is always a challenge, but I didn't feel that being a woman necessarily was something that was a block. I actually feel thankful for being a woman in that profession.
Lovely to hear. Dr. Zwas or Dr. Rosen, do either of you want to share?
So I have to say that I think that it is a challenge being a woman physician and that you have to work harder. I was the only woman in my division at Hadassah for 9 years. Now I've been joined by three more actually. Someone just passed her board, so which I'm very grateful for. But I think there are simple little things that make it much harder. When I walk into a patient's room, a patient doesn't think twice about asking me to bring him a glass of water. He would never ask a gray-haired male doctor to bring him a glass of water. And at one point, you want to be a decent human being and help a suffering patient. At the same time, there's just a bit of extra effort that comes along with being a woman physician. I think there are real challenges, both, trying to, as Dr. Rosen mentioned, maintaining your work-life balance, which is a tremendous challenge. And I think it's a challenge here as it is throughout the world.
Thank you. My next question is, why do you think Israel in particular has been so successful in advancing women's health? What sets the medical system there apart from the rest of the world? Dr. Rosen, you touched before on the size of Israel. Dr. Zwas, can you address anything else particular about the country?
I'll just say that I do believe that the startup nation model is very much part of what helps us promote women's health, women's heart health in our case, and women's health overall. I think there's something wonderful about this country in that we seek out the needs, and then we believe that we are the ones who will be able to solve those problems. And I think that's really helped us fearlessly move forward. Sometimes we succeed, sometimes we don't succeed, and then we just keep going.
Thank you. Dr. Rosen and Dr. Galili-Weistab, would you like to add to that?
I think some of it probably, going along with what Dr. Spot said, some of it is just it's the temper. Is you want to get things done. It's a startup nation, but then when the companies grow, then they're bought because that's what we're good at, the startup. We're fast. I think it's a culture thing. We work fast. We answer emails. We all WhatsApp. We don't even email. It's things are very probably they're informal. You can just turn to anyone that with just a WhatsApp message, say, I had this and that idea, what do you think? And then that person would say, oh, I know the person for you, let me hook you up, he sends you that. And then, so that's it's like a temper thing. I think that's the way we go. We're like very quick and it's all around. I have probably 3 or 4 startups in my mind that I'm thinking what I can do to make them happen. Just probably not enough time in the day or the week or the month, but I think it's maybe some of it is it's the culture, it's the temper.
Thank you. We have Dr. Galili Weistad, please.
I want to throw in the resilient part of I think of our being. For over thousands of years, we've been resilient. So we're improvisers and we kind of adjust to changing situations. And I think that kind of flexibility and creativity is what attributes a lot to that.
Thank you. The next question is on anti-Semitism. How has growing anti-Semitism impacted you? For example, I've heard that some Israeli and Jewish healthcare professionals in the US are facing boycotts and a great deal of vitriol from colleagues. Have you experienced anti-Semitism when you attend medical conferences or events outside of Israel?
Well, I have to say that I haven't really left here since the war started. So I don't know, but I am in a WhatsApp group of maternal and fetal medicine specialists worldwide, and I haven't experienced anything there. And I know a colleague of mine spoke about two of the girls that were hostages were treated in twins clinic and when they were in utero. So he spoke about them when they were hostages in a large conference, and he had sympathy. So I mean, I hear about it a lot. I hear it from colleagues abroad, but I have not experienced any myself.
So I will say that we have submitted papers to journals that were dismissed as being out of scope when they were clearly in scope by editors with surnames that made us that convinced us that the reason for that decision may have been political rather than scientific. I will say that my personal experience in traveling abroad has been positive. I have to say I was very anxious about how we would be received, but people, often went out of their way to reach out to us and tell us that, their responses to October 7th and their horror at much of the anti-Semitism. So it's possible the people who didn't want to reach out didn't reach out. But overall, I have not, been directly, confronted in a disturbing way.
Thank you. Dr. Galili Weistad?
I think like Dr. Rosen, I only traveled shortly once, and it was for a conference about the binational work. So we did experience difficult and harsh questions myself, and also, I must admit, my Palestinian colleague, who was criticized for having normalization relationships with a Jewish Israeli professional. But I find it as part of the challenge to communicate that we are living together, we are working together, we are investing in a mutual future, and not kind to become over closed to that kind of criticism, but to try and keep the dialogue open, even though it can be quite challenging.
Thank you. Dr. Rosen, you mentioned earlier in your comments that our NICU is underground, that our mother-child center, so much has to be done during deliveries, during sirens, during bombings. What impact has the war between Israel and Hamas had on your ability to provide medical care and continue your research?
So I mean, from a just from, I'm trying to think how to say this. From just space, when we had to move the NICU downstairs and we lost like half of our NICU beds because the space that was downstairs at -4 was just smaller. So we had to transfer some of the babies, and then mothers that delivered early had to deliver away from home, which is very hard when you have the mom, she recovers, she goes home, and then the baby can stay in the NICU for 3 months. But then it's so far away from home, but there was no option because we only had so many spots for the babies when it was underground. So I mean, it sounds small, but it's a big impact on a family. And for us I mean, I feel like I relate to what Dr. Galili Weinstein said before about resilience. I think within me, I found resilience that I didn't know happened. I live probably a 40-minute ride from Hadassah. So I drive 40 minutes to Hadassah and back. And I just, so many times I found myself driving through a siren, stopping at the side and thinking to myself, this is a crazy situation. I just stopped. So the miss out, like, why am I stopping now? And then the siren was done, and you hear the boom, and you say, okay, what should I do now? I'll go behind the wheel, and I drive to work because that's what I do. And then you get to work, and you have your coffee, you maybe like unwind with friends for a little bit, and then just go ahead and work. I think research wise, for me, I didn't have the concentration, the ability to spare the time, just the mental time. When you do research, you really need to be focused. You need to be, you need to be at a very high level thinking. And it wasn't there. We were more like in a surviving mode. So for me, the research just, maybe we took it slower for a while, hopefully now starting to pick up again.
Dr. Galili Weistub, how has the war affected your work?
The point is it's affecting the staff as much as we're part of the community. So psychologists and psychiatrists are either serving in the army or or their husbands are there in military service. They know people that were unfortunately injured or killed. And we work with our feelings. I mean, psychiatry is not a profession that you can say like, it doesn't matter who you treat because anyway, you're putting a white coat on and you don't see religion, you don't see gender. We see religion, we see gender, we see feelings. We encourage them to talk about the feelings. Our feelings are present. So these are challenging times. At the same time, I think as a society, for the first time, we feel a combination of being totally impotent and totally potent. It's a very weird combination that we cannot affect the big things, but we can do a lot. So it has been a very difficult, meaningful, fruitful, encouraging period professionally.
So I have to agree with Dr. Rosen. As the mother of 3 soldiers, I definitely found concentration rather challenging at different points along the way. And as a professional, a lot of what I do is prevention, but when I have one patient whose sugars were completely out of control. And I said, what are we going to do about this? And she says, I have 10 grandsons fighting in Gaza right now. Don't talk to me about my sugar. And what was I supposed to say to say to that? Patients whose sons and grandsons were wounded, who lost children and grandchildren. It's I think providing care in these settings is extremely challenging. But I do agree with Dr. Galili Weisstab. We've been, and Dr. Rosen, we've found sources of resilience in ourselves and creative ways of addressing issues that have helped us feel that we really are making a huge difference in these difficult times.
Well, thank you. So we have quite a number of women on here today from the Hadassah organization. And I want to ask you, is there anything that Hadassah as an organization or the women of Hadassah can do to show our support and to help you in your personal or professional lives?
Are the questions to us or the attendees?
To you. How can Hadassah help? Is there anything? So if you
Yes,
don't
I
have-
think,
go ahead.
but I mean, what I feel is we need funding for special programs to make sure we have all our ducks in a row and we have the best healthcare we want to deliver. I think we have the people, we have the knowledge, we have the will, and many times it just stops with funding, or it doesn't stop, but it takes more time and to build without funding. So I think that's one thing, and the other thing would be
Can I
it's
ask
just
you, are there specific funding needs that would help you move your work? You have a captive
Sure, I
audience.
have so many
Dr.
ideas.
Rosen.
Yeah, I'm not sure you want to hear all of them. But also I think actually, I mean, some of the questions that you asked us here now, I've never even stopped to think about how I feel in this situation, you know, or we're like on the run. We do things. We're on the go. And I didn't get to stop and think how I feel about it and how it's been to deal with this. So first of all, thank you for that opportunity. And I think that the connection with Jewish women worldwide for us is very important, to feel like they're in this situation, and not only in this situation, even before these current events, to feel that we have connections worldwide, and we have people that support us and support us, and our success is their success. I think it's very encouraging, and it helps us do what we do here in
Well,
Israel.
thank you. As the CEO of Hadassah, I'd like to address anyone who's looking for ways to help. There are many ways to help, including, first and foremost, making sure that you're a member of Hadassah. By joining Hadassah, you're supporting the work that we do in these hospitals in a major way. In terms of funding, there are lots of opportunities, and if you contact me or anyone in our philanthropy team, we'll be happy to share quite a number of opportunities within our hospitals for the life-changing work that we're doing. And the last piece is go to Israel. Go to Israel, bring your friends, visit the hospital. It's a wonderful opportunity to tour our medical organization, to see firsthand the work that's being done, and to share it widely among your friends and colleagues. So thank you so much for that question. As we close today, we're getting close to our hour. I want to thank you, Dr. Galili Weisstab, Dr. Rosen, and Dr. Zwas for joining us today. I know I speak for more than just myself when I say that today's discussion was inspiring, and we are so grateful for everything you're doing to bridge gaps in women's health and build bridges to peace through medicine. Your work in mental, maternal, and cardiovascular fields are saving lives and advancing the Beijing Declaration, not only in Israel and the Middle East, but across the world. I wanted to share that I was recently a patient at Hadassah Hospital in Jerusalem, and I was really struck by the mission and what's happening in the hospital, not only seeing patients, but doctors and nurses and therapists and healthcare workers from all aspects of life in Israel, religious Jews, secular Jews, Arab Muslims, Christians, all working together side by side. And I had an incredibly impactful discussion with a female doctor in the hospital who shared with me that she was treated in the hospital as a teenager. She's an Arab woman, lives in Israel, and was inspired to go into medicine, has become the first member of her family to graduate college, and now has a professional field as a physician in Hadassah Medical Center. So that was really inspiring and exciting for me to meet her. I want to thank you, our audience members today, for joining us and for asking such great questions. I want to give a thank you to the Israel Women's Network, the Simon Wiesenthal Center, and to Dr. Deborah Safin for your support and your partnership. Thank you all.